It started in 2016. I was working at the mines. I felt this burning sensation behind, like my back. Just never thought anything of it. I did do physical blood work and checkups, right? But they never caught on until I mentioned that burning sensation. That was already the fall time when I felt that. But next year in 2017, in January or February, I don't remember. I mentioned that with my doctor, my family doctor, and that's when she tested me for my kidney function. And it was 30%, 30% kidney function on both sides. So they transferred me to a hospital right away, get all tested, and I didn't know anything about dialysis. I'm like, what's dialysis? What's kidney failure? They're explaining the acute and chronic. And I was like, what the heck? It's known as Berger's disease or IgA. So they just said, so work with your 30%. I'm like, oh, okay. Till fall time, August, that's when my health was declining, and I noticed the color of my skin was kind of turning yellow, and I was getting weaker. It was like plus 35, 39 outside. I was still cold. I was losing weight, and that's when they did an emergency hemo surgery, right, to start hemodialysis. They inserted the PD tube in November of 2017. And I actually started in January 2018 and then 2019. And then I got the call for the kidney transplant March 8, 2019. So I was on dialysis about 2 years. While I was on dialysis, I ended up getting pregnant, which was pretty rare. Women on PD would give birth to babies, usually premature. And I was in that time, I had the tube in and wondering if I should go forward with it or terminate. But meaning that I still have toxins in my body, it would affect the baby. So what they did, instead of 3 times a week on hemodialysis, they increased it for 6. Instead of 4 hours, they did 6 hours for 6 days. The only day I had free was Sunday. And I did miscarried after maybe 3 weeks. I think manually was easier for me. I would travel with my son to Edmonton, and I would just drain. I would just stop, put the tube, put the bag up, and travel, drive again. Yeah, it was easier. And some people forgot that I was sick because I was taking care of myself, and some people forgot because I didn't act sick. I didn't like post on social media. I didn't tell people that I was sick, like telling people that I am sick. I just acted like I was already healed, that nothing's wrong with me, because I had that mindset already. I traveled to Toronto with PD. I don't know, I went everywhere. I did go to Edmonton, just me and my boy. Yeah, Calgary, up north, Churchill. Be independent too with your PD. You can't always rely on people. You know, some people, some family members get training and they end up relying on that. Learn to do your own treatments and have a list what you all need and keep your area clean. Getting listed took long. It takes long. I think it took me about 9 months to get listed. They had to make sure I'm taking my meds on time. They're checking it with blood work. That's how they know. And my diet. I was careful with my potassium and water intake, making sure I do my PD all on time. They had to make sure everything was good, and they made sure I didn't get any infections. My mindset was like set for a year, 2 to 5. And I was like, I gotta take care of myself that long. Because as a single mom, the only sole provider for my boy, so I need to have that mindset. And then I was listed for kidney transplant back in, same thing, December 2018. And the next 3 months, I got a call for a kidney. March 7, 2019. It was just a normal morning. Like, I had afternoon classes, just got ready, made myself breakfast and my son. I put my phone down, facing up like this. I was about to eat, my phone rang and I looked at it because I know the dialysis unit, it has a different number. And this time I was like, transplant. I'm like, why are they calling? I already did all my testing. But I'm like, okay, hello. How are you, Ronelda? I'm doing good. How are you? He's like, I'm good. He's like, have you had any infections lately? I'm like, nope, all good to go. He's like, well, okay, well, we have a kidney for you. I'm like, what? He's like, we have a kidney for you. So like, and I was speechless. I remember just sitting there, just like my body, like, that tingling, just going through my body. I didn't know what to say. I looked at my family. I looked at all of them. I hung up the phone before I even said anything because I know it was deceased tape. So, well, he told me it's 100% match. It's pretty rare. Before I even told anybody that was around me, I did a prayer for the family. I gave thanks and everything. I was just grateful for everything. I did a little prayer for the family first and this kidney donor. And then that's when I looked over at my sister. She was feeding her newborn baby that time. And I was like, I got a kidney. Called on my niece, everybody in the house. They were all crying. Oh, I was crying too. So they wanted to test me for my antibodies again. And I was like, okay, I'll do that right away. And he did explain what to expect, like the surgery. And then I woke up from the recovery room and I was confused and the nurse was waking me up. And then that's when she explained that I had a kidney transplant and it was successful because I forgot where it was. And I remembered, and then I remembered that warm feeling in my stomach, like that throbbing pain. And I just pressed the button and went back to sleep. When you get a kidney transplant, like the door closes, another door closes, another door opens, like in your health, right? And dialysis, where you have to be consistent with it. And then if you do get a kidney transplant, it's not considered as a cure. It's a treatment. But 2 weeks after my transplant, I got sick because your immune system, everything's low, and somebody was near me. I was sick, and I didn't know, and I got sick, and I ended up getting pneumonia, fever. My body almost rejected the kidney. So I was in a hospital again, trying to fit, and then they figured out what it was, and they gave me the proper antibiotics. And then my kidney functioned, my body accepted the kidney again, and then it's been good since then. Yeah, I caught COVID. I got sick. I knew I had COVID, and I started to feel, because I already know the procedures, right? And if you get pneumonia, it's basically dangerous for your kidney. So I knew pneumonia was coming on, so I went to the hospital. They admitted me right away, and I was worried that I was getting dehydrated because I couldn't keep any water or food down, just that couple hours, and I knew I had to go to the hospital to keep me hydrated. Couldn't breathe well, but because I admitted myself, well, I got admitted early, so they caught on with everything. That's when I started losing my breath. Second day in the hospital, that's when they almost put the breathing tube, because anxiety, panic attack didn't even help. So they put me on the pressurized first to open up my lungs, and that helped. So they ended up putting me back on the airflow, and that helped. So my oxygen was staying at that range. If it dropped, then I would go on the breathing tube, be in coma. Good thing I didn't. My kidney, everything was good. Like not everything. My kidney was good, but COVID almost attacked my liver and my lungs. But my kidney was good. This is 1 week supply. And this is 1 day, morning, night. We have to take it on time every day. So you're on it for life, hey? And you can't miss a day. The morning and night has to be the same night every day. You have to be really determined in taking your meds on time. I have an alarm. I know it's hard, like some days you forget, right? But you gotta let your family know too. And because they, like my son, he already knows what time I take my meds. Mom, did you take your meds? I'm like, yeah. And if he hears my phone ringing, and that's when he'll give me my medication, water, or sometimes he'll just tell me, you gotta take your meds. And always remember, when you travel, think of your meds first before anything else. Because your immune system is low, hey? You're immune like you're like a newborn baby or an elder. So it's like, you gotta be careful with getting sick easily, anything. Especially if you get a cut on the skin, you gotta treat it right away. If you leave it, then it can get infected, or like a common cold hurts more. I used to like, oh, it's just a cold. But now if I do get a cold, I'm just getting over mine. This is like 2 weeks, over 2 weeks now, and just the cough is slowly going away. And making sure you keep everything up to date with your doctor, what's going on with your body, and blood work. Your blood work, yeah. You can get sick easily. When you get a transplant, you got to drink more water, you need more potassium, magnesium, everything. Right after a transplant, my taste buds was so intense, it kind of made my tongue tingle after I ate. And I had to like little slowly start eating again, and I start eating lots. And you gain weight. You gotta watch for your weight gain too. They gave me a lot of information what kidney disease is first, the stages of it, the types, how people get kidney failures and stuff. They educated me how people get there, hey? And then they told me about the treatment, the dialysis, and I didn't know anything about it. They had to explain how the kidney works for your whole body first, and why, like just every little thing, like the PD, what it does, and then the hemodialysis, so that the blood comes out, and then the potassium, they clear it out with toxin, it goes back in. That sounds scary. And then it makes you feel better. I was against it because I wasn't sure, but what they can tell people that are discovering they have kidney disease is that dialysis does make you feel better. It does take out the toxins in your body, and it does help you with somewhat energy. Better than feeling sick. I already knew about the organ transplant, and I already looked it up. I knew about it, but I didn't know anything about treatments and how the body works. I just thought, oh, I have a kidney disease, I'll get a transplant. But it's actually much more complicated. Your body has a big chance of rejecting. And that's when the anatomy, that's when they taught me about the body, how it works, your blood work, everything. When you get a kidney transplant, like the door closes, another door closes, another door opens, like in your health, right? And dialysis, where you have to be consistent with it. And then if you do get a kidney transplant, it's not considered as a cure. It's a treatment.